Hi, my name is Dr. Jordan Claybourne, and I'm the therapist here at RPT. If you're in pain and want to move better, come see me. So I'm doing active release on the upper trap right here. He's got some tightness throughout the body of the muscle. So I'm gonna apply pressure here as I pull his head away. And then I just repeat. So I'm just doing a quick joint assessment of the vertebrae in the neck. And he's tighter on the right side. Just a quick assessment of glide between the vertebrae and the thoracic spine. His is very tight. And then get looser as you get down towards the lumbar spine. Knots present here. And he's stuck actually right here, about T6, thoracic level 6. If I can just apply a little bit of pressure here. Go ahead and breathe out for me. All right, his glute medius is tight, so I'm just doing a release technique, a mix between active and passive release, moving the motion or the muscle while I apply pressure. I'm just taking the patient through hip mobility, checking the different capsules. Right here is posterior, motion's good there. I'll take him out to anterior capsule with external rotation, still pretty good. Does that feel all right? Any pinching up here?
Yeah, that's good.
So inferior capsule is good. This is a scour test. Say that he has any type of defect at the joint, like arthritis, this would reveal it. You have any pain there? And let your knee just fall out. Any pinch or pain there? No, it's a good hip health there. A lot of times, people having trouble with their squats causes back pain. You can fix the issue by opening up the hips. Here's your column or your spine and the vertebrae that make it up. These lower 5 are the lumbar spine, and each one of them, from the bottom to the top, have a nerve coming out of a hole. You have a slight compression here on this side, and if you compress a nerve by degeneration here or just a hard twisting motion, that nerve will send a jolt or electric signal down your leg, causing numbness, pain. If it's bad enough, it can be weakness. So we can alleviate that by either applying a traction force, so pulling on your hips to create a gap here so that the pressure is relieved. And once we get that pressure relieved, we can then exercise, strengthen the core so that that gap stays. So it's not just a temporary fix. I'm using IASTM or instrument assisted soft tissue mobilization. It saves my fingers, but it also is a good way to break up adhesions in the knee. Say that he had surgery here, ACL or any type of major surgery, I could go ahead and break down scar tissue from an incision or from a past injury. It really brings a lot of blood to the area, remodels collagen, and creates proper healing environment and speeds it up. So different techniques, I could take it and scrape the area that I'm trying to target. Usually it'll be here on the tendon, or I can just apply pressure up the belly of the muscle. All right, so this is therapeutic cupping, typically used to treat muscle tightness, pain, adhesions like knots or scar tissue. You see they turn red almost instantly, which is a good indication that the blood is flowing. Blood flowing into an area warms it up, makes the tissue more extensible, and therefore it can stretch out. It feels a lot more relaxed after we take these off. How is that?
It's good. Can you put some off on my neck?
Yeah. I usually do these to patient tolerance, so it's not about how many pumps they can take at first. I want to make sure that they're not going to bruise too much with the first session because there will be mild to severe bruising, but it doesn't create pain. It's not going to be too tender like a normal bruise would be because there was no impact or major trauma. Is that okay?
Yes.
Yeah. Cupping's good for pain, flexibility, muscle spasm, and blood flow, so healing. And I'll just leave these on for 3 to 5 minutes, unless I forget about the patient.